These are some of my baby pictures. I should tell you, she did not, I was thinking I should have brought a picture of her day 2 in the NICU, because my husband's ring, his wedding band, would slide all the way up her arm, as you all probably have had familiar, and we have that picture. And then to look at the pictures behind me, that she'll be 2 next month, and she's thriving. But her story is a success story that was never supposed to happen. In fact, we were told with absolute certainty that she would die. It's been an interesting journey. I have been in Congress as my 3rd term. In my 2nd term, we decided it's time, I've gotten through my reelection, it's time to start having kids. I'm not getting any younger. And got pregnant, and it was about May of 2013, went in for my anomaly scan, a 20-week ultrasound. And the doctors basically said, there's no fluid. Your baby does not have kidneys. And what does that mean? What does that mean? And the doctor said, it means that there's no fluid in there, that her lungs will not, we didn't say her, we couldn't tell if it was a boy or girl, they won't grow. And so she will either miscarry or she will be born and suffocate moments after birth, because her lungs will never develop. And as he's telling me this, I can feel her moving and kicking inside of me. And my husband and I were obviously devastated. And I'm trying to, we're crying and you're upset, and you say, well, what can we do? Is there anything we can do? And he said, there are no options. There is nothing that can be done. It's called, the diagnosis is bilateral renal agenesis, meaning 2 kidneys never grew. And I said, well, what if her lungs do work? What if there's a miracle and it does work? He said, there are no dialysis options for babies, and there are no transplant options for babies, which now I know is completely untrue. But if you don't have any experience, you're just a parent, you're a first-time parent, the doctor says something like that, it's pretty definite. So we went home. We were obviously devastated. I took some time off I basically just disappeared. My husband and I took a couple weeks just to regroup and figure out how to handle it. And in the middle of that time, it was pretty awful. She's moving and kicking, and we want her, and we're told there's nothing. You're just going to have to walk this out. There's nothing that can be done. And we decided, against all odds, that we were going to fight, and we didn't even know what that meant. I returned back to work and had made my story public. I waited till I was 5 weeks pregnant to make public that I was pregnant, because you get past that first hurdle and everything's supposed to be A-okay. Well, about 2 weeks after that, I had to then tell everybody that, it's a fatal diagnosis, but I'm going to believe that it's going to work out. And people thought, oh my, that was a really long couple of weeks. My colleagues here in Congress were incredibly supportive, but they were sad. I mean, it's really sad to watch a pregnant lady walking around knowing that she's not going to get to keep her baby. But I was unwilling to be the one that ended it, because I wanted her to live. And so we put that word out there, and through just a series of miracles, a dad reached out to me that I'd never met, didn't know anything about, who had read about my story, I think in USA Today. He goes, it's a paper I never read, and it just happened to be at the hotel I was staying, so I picked it up and I saw your story. And I've got this doctor you need to run down. Because of course you get different opinions, you get second opinions. All the OBs say the same thing: this is not treatable. He said, you need to talk to this woman. She might treat you. She might, because I had said, well, why can't you just put some saline in my womb? Why can't you? Can't you grow? If the issue is no fluid, why can't we put some fluid in? It won't work. You'll get an infection. It'll rupture the membrane. It just won't work. Well, this dad had said, well, we found this doctor who might be willing to try. And I went up to meet her. And she said the same thing. After looking at everything, there's nothing can be done. And it was about an hour-long visit, and she took the time to sit with me. And I'm not even sure what did it, but I kind of had my cell like, okay, an ultrasound is based on fluid. And if there's no fluid, you can't see for sure that there are no kidneys. It could be something else that could be wrong, right? Well, yes, that's accurate. So why don't we go ahead and put fluid in so that you can take an accurate picture? Let's do a diagnostic infusion. And she said, okay, I won't do it for serial treatment, but I will do a diagnostic infusion. So we set it up, and I came back the next week, and she did it. She stuck on, it's like a reverse amniocentesis. I mean, instead of taking fluid out, you're putting fluid in. Sterile field, and we watched on the ultrasound as fluid entered my womb, and we watched Abigail begin to move. I mean, she was an active kid anyway. She was pretty squished. I mean, your womb is basically a giant muscle, and so she was pretty much shrink wrapped, and so she threaded the needle in there and put fluid in, and she just went kind of nuts. She opened her mouth and she swallowed it and began to what they call practice breathe, which is a good indication in terms of the beginning of lung development. And she just started, I think she was breech, and she flipped around, and she loved it. And I think everybody in the room was so excited at her response. Something changed, I think, in the hearts of the providers, and she said, okay, I will do serial infusions, and here are the rules. If we endanger your health, I quit. You quit. You can stop at any time, but I'm willing to move forward if you are. And I said, I'm in. Absolutely. This kid is healthy. You know, they had done an echo. They had done a lot of different things, and best we could tell, the only problem was kid just did not have kidneys. At that time, her feet were clubbed, and her chest was kind of squished, and her head was squished. But I mean, she had been in a womb pretty much shrink wrapped. By the next infusion, her chest began to flatten out, and her head flattened out. By the time she was born, there was no external issues. There were no club feet. Her head was a little cone-shaped. Don't tell her I said that. Part of it was because I had been in labor for 4 days, and we were trying to stop the labor because she was 28 weeks. That's kind of phase 2. But it all, I mean, as you can see, this is my favorite one, the one with the dress. That was the cloakroom, the Republican cloakroom, I think last week. She never wears sweet dresses with her hair perfect, and that was my picture. The dirt one is a little bit more accurate. That was planting flowers. She likes to eat. As you can tell, there's still an NG tube for nutritional purposes. We are growing her to transplant. So my husband will be the donor. Both him and I are a match. And the issue is just she needs to be physically big enough to receive an adult-sized kidney. They don't put baby kidneys in babies. They put adult kidneys in them. And the field has changed radically. Her prospects are for a full adult life. She's not cognitive. I am the first to tell you she is not cognitively set back. In fact, if anything, she's starting to work circles around us, which is terrifying. Really, the only thing that we've seen in terms of long-term impacts, I think, probably are the NG tube. You know, she was hospitalized for a solid 4 months, because she was that premature. The other thing that I feel like is really important, so fast forward to her coming, I went into labor and kind of panicked. I was on the West Coast. The plan was to give birth out here, because I had been kicked out of practices. Like, people would not treat me. I found one doctor that would treat me, and I had to convince the NICU staff if we have any neonatologists in here, you guys are tough nuts to crack, but you're crackable. And that's part of why I tell my story. This is all about parent advocacy and supporting families and empowering families. Because the healthcare providers get into this to do the right thing, but there's just so much coming at you. And had my husband and I not advocated every step of the way in a totally unknown field to us, she wouldn't be here. And sometimes those neonatologists, man, you gotta push sound theories with them to get them to go along. But they did. And when we got to the point where she was coming, I think I was in labor and we transferred to 2 or 3 different hospitals. I think everybody was like, hot potato. We don't necessarily want this one. And they were trying to keep her in. And by the time I knew she was coming, it'd been about 4 days. And, she was 28 weeks, little over 28 weeks. And I just remember the room being full, because there's all these providers and there's specialists and there are all the teams waiting kind of for the worst. I mean, what their clinical experience had told them is these babies die. And I think they were expecting a pretty traumatic experience. I, on the other hand, knew she was going to live. I knew beyond a shadow of a doubt. I was exhausted. I didn't know what everything was. I didn't know what was going to happen. I didn't know what was going to work or how it was going to work. But my husband and I had this kind of uncanny just push, because I didn't say this, but after we had gotten that diagnosis, we decided as a team, and I think I heard somebody allude to it, the family stress that happens in these situations is indescribable. We had decided we're going to link arms, and come hell or high water, we were going to push together to do whatever we could. And so that allowed us to be unified in our approach, especially when we had many different teams telling us different things. And so we were ready for her to come, and the providers were ready for, I don't know, the Armageddon. And she came, and she opened her mouth, and she drew a breath, and she cried. That meant that her lungs were able to exchange oxygen, and she was breathing room air. We didn't have to put her on a ventilator, which is quite amazing for a 28-weeker, let alone a 28-weeker who had been through what she's been through. Now, she was 2 pounds, 12 ounces, and she was kind of mad. I think she was a little upset. So that was early in the wee hours of a Monday morning. By about 10 o'clock, I got some rest. Everything settled. They put a line in that they didn't necessarily need, but they wanted, because that's good common sense. You don't want to have to put a line in when you're in an emergency situation. And then the question was, okay, what are we going to do? I was on the West Coast in the Portland area, and I had thought, well, the hospitals here weren't necessarily wanting to do dialysis on such a young preemie, but now that she's here, I'm sure they'll do it, because we're here. It happened. And unfortunately, we didn't have that option. So it was about 10 a.m., and I had a long labor. I had IVs and all sorts of fun stuff. And my husband and I were told, well, one of the options is just to do nothing. And I'm like, what do you mean do nothing? If she doesn't get going on, if we don't do the surgery and put a catheter in, she starts doing the peritoneal dialysis, then she doesn't survive. She dies. And they're like, well, that's an option. And I was like, that's not an option. She is beautiful. She's healthy. She fought to be here. We have to fight to give her a chance. And so we, for several hours, just got on the phone. I'm in a hospital gown, running back and forth from her room to my recovery room, and my husband's running around. We're making phone calls. We're calling everybody we know who has anything to do with medicine, saying, we need help. We need to go somewhere, and we don't know what to do. I'd call my doctors back here, and they said, well, we'd love her, but we're not going to have you put her on a 6-hour flight. And I said, okay, well, where do we go? And we're on the West Coast. And they said, well, you can go to Lucille Packard down at Stanford, or you can go up to Seattle Children's. And we're like, great. We called them both. Stanford called back first, and they arranged a life flight. And I remember sitting in her NICU, in her hospital room, and they're like, okay, good news. We have somewhere for you to go. And I'm thinking, wait a minute. My husband and I figured that out, but okay, we'll take it. And they're like, well, I don't know if you can go. There's only room for one, and I don't know if we can discharge you yet. And I was like, I will remove the IVs from my arm myself. But I'm getting on that flight with my baby. And the whole way down, I was nervous. I think the poor transport nurses were nervous. And she was just chilling in her isolette. No issues, stable numbers, every bit a miracle. And we got there. They were like, well, we've never done someone this age, but someone's got to try. And I said, that's all I need. I know you guys are not going to work miracles. But she's tried, we have to try. And her course of care was remarkable. She really has been, and that's not to say we haven't had our downtimes, but she has really flown through this. She receives peritoneal dialysis every night. We put her down and pick her up, and she sleeps through it at nighttime, and then in the morning we're gonna hook her, and she just goes. And she is a tough kid entering her second year. That's what I wish the doctors would have told me. They give you this whole list of, this is everything that could go wrong. And I'm thinking, nobody said anything about the twos. That's what would have been helpful. And so that's our story. And it has led me, I've learned a lot, and I still continue to learn a lot. I've learned that nurses, especially NICU nurses, are like the Navy SEALs of nursing. I have learned that there are the amazing care teams, and what they do to come up with a decision for a complex case is really, it's incredible. They get everybody together, and they get the specialists, they get the generalists. I kind of think of neonatologists as like the general contractor, and then for us, we had the nephrologist, and we had The pulmonologist didn't really have a place in our group, which we were glad. We didn't need you, but they just all get together and they work to make sure that the best outcomes are possible. The area where I see that we can make a change or we can improve is we can get families, and some places do this really well. I think some places are learning, is families do need to have all the facts. They need to be well counseled, and they need to know what they're looking at. But my experience has been, and granted my case is a little unique, if you are on the fringe, if you're on the edge, if you're on the cutting edge of where medicine is, had my husband and I not had the support to be as strong advocates as we were, we would have stopped many times along the way. I have probably 3 or 4 moms a month who contact me who have a BRA diagnosis. And I have gone to bat for every single one of those moms across the nation. I have now 3 doctors, 3 OBs who will treat it in 3 different states. That's it. And I try and get these moms to these OBs. And then the second phase is obviously for us is the dialysis care. And not all NICUs are the same. Not all specialty hospitals are the same. And so that's a second phase of this. Part of what I'm really hoping comes out of this is that we link a little bit more carefully what OBGYNs know and tell their patients with what the pediatric specialties know. I mentioned I was told there's no dialysis on babies. I was told there's no transplant on babies by an OB. Well, that's not true. But they didn't know it. I didn't know it. How do we link what the specialties are doing? And even, I think, the bounds that are being pushed. I am grateful for the internet. I know most doctors are kind of like, whoa, the internet. You get all this, these parents get all this false information, and then we have to, deal with unrealistic expectations. That is true, but I think it has also served as a way to push the boundaries in a good way, which is why I've told my story. It's not because I want my poor kid to be the center of attention. It's because I want other moms to look online, and now when they get that diagnosis, they can say, well, it's 99.9% fatal, but there's been a first. And actually, I can tell you there's been a second. And a third, and I'm working with some other moms right now who are in the process, in the pipeline. So we hope that this precedent is going to change things. But it really does lead to, I think, a greater need for collaboration and a recognition that parents have to be empowered. There's a couple different bills I'm working on. One is the ACE Kids Act. I don't know if it's been brought up yet. But what I learned in my experience was if I'd have been on Medicaid, which is the state welfare plan in each of the 50 states. It has different names in different states. When I needed to transfer from my home down to California, I may not have been able to do it because Medicaid will pay for things in state. And that to me means you're limited by your zip code. The reality is we have amazing children's hospitals all over the nation, but not all children's hospitals are world-renowned in every single specialty. So these kids need to get to the right place. And I don't think we can recreate those hospitals in every community. That seems duplicative to me. What makes more sense is to break down those state barriers and allow those kids to go where they need to go. And the bill that we're working on would use those children's hospitals as anchors and let them better coordinate the care, taking some of the burden off parents who have to see multiple specialists as their kid. My daughter, we have teams of specialists. Those of you who've had preemies, you know exactly what this means. We want to take that burden off the parents and allow that coordination to take place and allow those kids to be where they need to be. We're very excited, and that's a bipartisan effort. There's another one that I'm working on. I'm actually also trying to add pregnant moms to the ACE Kids Act because some of these moms who have BRA come to me and say, I'm on Medicaid, and no one I have had this more than once. No one in my state will treat me. I've been to every major medical facility. No one will do for me what someone did for you. And I'll say, well, I can help get you to Johns Hopkins in Baltimore. That's where they treated me. Or I can get you, there's a place in LA. And then comes, well, I'm on Medicaid and the state won't pay for it. I have had to walk this more than once. And I usually don't ever say no. I mean, I'm not above calling and cajoling and bugging, and I never threaten. But it shouldn't be that way. It doesn't need to be that way. So I'm working on getting moms covered under this as well, pregnant moms. Another area that I'm working on and I think is going to add to this conversation, because I really feel like we need to more join the OB world with the pediatric specialty world. And some places do this really well, but I want to see it across the nation. I think everybody deserves that same standard of care. One of the things that I have found is in the testing on prenatal screenings, screening can detect a problem or a potential likelihood of risk. But what I'm finding is, whether it's the company or whether it's the OB not knowing, that information is not always accurately relayed to a parent. There were 2 industry-related studies recently indicating a baby, so they reveal that results indicating a baby is at high risk for chromosomal conditions can be false about half the time. Another study, samples from 2 women who were not pregnant were sent to 5 testing companies for analysis. The companies returned the samples telling the women, congratulations, you have healthy babies. So it just shows, when I have gotten into this in terms of what's regulated and what has to be told and what the numbers actually are, it's a whole, boy. It's not, so as a mom, and you get given a diagnosis, you think this is accurate, this is completely, this is jumped through all the hoops, the FDA is on this, my doctor knows. Oftentimes the doctors don't even know. So we're in the labor HHS health appropriations bill that we just passed out of committee yesterday. I've added some language to have the CDC, the National Center for Birth Defects, help us get that information. We're gonna make it more accurate, so that when a doctor and a mom have that conversation, they know exactly what they're talking about, and so that parent is more empowered to make the right decisions for their family as they move forward. So those are a couple of things I've been working on as a result of where I've been in the last 2 years. I want to say thank you for what you're doing. I think, man, preemies are amazing. They're not little adults. But they are some of the toughest members of our society. In addition, they're the most vulnerable. How amazing is that? Like, they are resilient and strong, and they overcome things that you and I, we'd wither at some of the things they come through. And yet they are the most vulnerable. They have to have advocates. And sometimes I get frustrated because I feel like preemies or children's medicine doesn't get the attention it deserves. I don't know if it's because kids can't vote, but that's a big... That's important to me, that we shift that focus, because if you're really talking about, and then I hear people say, well, it's too much money to put on da-da-da-da-da, and I stop and I say, wait a minute. If we're talking about healthcare expenditures per person in the United States, I would rather put the money on the kids who have their full life ahead of them, in terms of, if we're really gonna talk ROI, I think that's a good place to spend your money. That doesn't hurt us, that helps us as a nation. I mean, I look at what my daughter, I think, what's my daughter's potential? What's she gonna give to society? What's she gonna do? I already know that she's been a trailblazer for other children who would not be here if it weren't for her. And I think, multiply that times these children that we're talking about and trying to figure out how we can advocate for them, and it gets me excited. So I thank you that you're here, that you're taking your time and your effort to do this. It matters. I hope that this grows. I've got a couple of partners on Capitol Hill across the aisle, where we're looking at ways that we can take advantage of 21st century healthcare, empower parents and families, and really set the stage for these kids to live the bright futures that they deserve.